All right. Thank you for tuning in today. My name is Dr. Drtredtv, and I am here to share a story about something called estrogen dominance. And estrogen dominance is a term that was coined by a Dr. Richard Lee. And what he stated was that as people get older, they reach their 40s and 50s, and what happens is their sexual hormones start to change. In women, they have estrogen and progesterone in order to make their menstrual cycle work. Okay. And menstrual cycle is what produces the eggs and allows us to become pregnant. All right. And that works with estrogen and progesterone working against each other, balancing each other out. And when a woman has the proper amounts of estrogen and progesterone, such as when she could still have her period or menstrual cycle, she can maintain a very lean muscular build. And then what happens is when she becomes pregnant and there's no more progesterone being produced by the body because of the pregnancy, she's not having her period, she becomes what we call estrogen dominant. And the estrogen dominance, when a woman is pregnant, causes the body fat to start being shunted to the outer compartment, not the inner fat around the stomach, around the viscera. It goes to the outside, and this is preparing for that baby coming. You wouldn't want to carry the calories inside your gut around your baby where it's developing. You want to carry them on the outside of the body. And that's what estrogen dominance seems to initiate in a woman who's pregnant. And then she goes through the 9 months of term, and she's putting more and more body fat on the outside. And as soon as the baby is born, there's some other hormonal changes that happen. And what happens is that fat that has been accumulated during pregnancy begins to be released for the benefit of the baby and the benefit of mom. And as that starts to release those calories, the baby gets fed, mom loses that body fat. And within 2 months to 2 years, mom gets her period back, and then she gets her normal menstrual cycle occurs again. So estrogen is now being antagonized by progesterone, which is the normal occurrence to maintain a lean and muscular build. So now has the baby who's now 3 and 4 years old, and now she can become lean and muscular again. And now she's a mommy protecting machine. That's why women that breastfeed get rid of all that body fat, all that extra fat. Now, just because you didn't breastfeed or you did, what happens is this same process happens in men also. It's called andropause in men. In women, it's menopause. In men, it's andropause. But let's go back to the female. So she had originally had a normal menstrual cycle, and she became pregnant, and then the progesterone dropped down and she became what we call estrogen dominant, and that created fat in the outer compartment preparing for the baby. Well, when the baby was born and the hormones started to come back again, oxytocin and progesterone, now that fat is starting to be released for the baby's benefit. Once the baby doesn't need it anymore and mom normal menstrual cycle comes back, she can become lean and muscular. Now what happens is, and that's to be able to protect the child. Now that she's in her late 40s, early 50s, or possibly sooner because of stress, she goes into what we call menopause. Now menopause is a low amount of estrogen and not a low amount of estrogen, I'm sorry. It's a low amount of progesterone compared to the estrogen levels. And now what happens is the same physiological thing happens that happened when she was pregnant. That is, the food she eats is now going to the outer compartment, not the inner compartment. And this causes a thickening around the midsection of post-menopausal women who have been through menopause, and now they're starting to become thick around their midsection. And it could be due to overeating or drinking alcohol or having sweets. It's possible. But a lot of you out there have figured out that that's not what you're doing. You've cleaned up your diet. yet you're still have this thickening. Well, if it's hormonal from having high estrogen, which is what we call estrogen dominance, 1,000 sit-ups and 500 calories is not going to change that fatty compartment, because those fat cells around your belly and legs and thighs are swollen from the high estrogen. They're not swollen because they're holding a bunch of calories. They're swollen from the estrogen being high. And that is something that has to be addressed from an outside approach if you want to get rid of that. I mean, that's why liposuction was created. That's why they do incredibly dangerous things with fat freezing and fat burning and fat sucking and injecting and these different procedures, because people are desperate to look thinner and to get rid of that extra thickening. And the lipo laser that we're using is the best at treating estrogen dominated postmenopausal fat, because it uses a low energy level laser to, when you apply it to the skin where that fat is, the subcutaneous fat, after 6 to 8 minutes, microscopic pores start to form around the cell wall, the cell membranes. They form little pores, and then the fatty acid, glycerol, and water actually leak out into the tissue. It drains the fat cells just under the skin, about 1/8 of an inch deep. Now, those calories are fatty acids. Water is removed through the urine very quickly, but the fatty acids and the glycerol, they have to be brought into the lymphatic system through something we call a whole body vibration plate. So it's 30 minutes on the laser, releases 400 to 600 calories of fatty acids. Now it's trapped in the tissue where the laser was applied. And now we have to stand on a vibration plate that moves you, and that shakes the fatty acid into the bloodstream. Now, the rule at the spa is you need to be hungry when you come in. So you want to be no food 2 hours before you do the laser, 30 minutes on the laser, 10 to 20 minutes on whole body vibration, and no food 2 hours afterwards. And in the 2 hours that you leave the spa, you're going to burn off and consume that extra energy that was stored in the fat secondary to the estrogen dominance. You basically burn those calories. Every time you do the procedure, you will lose between 1/8 of an inch to 1/2 inch of girth measured with a tape every treatment. 9 sessions, 3 to 9 inches. Now, you can continue to go on and lose more inches, but we stop it at 9 sessions because that's a reasonable amount of time. It's cost effective, and a person gets enough understanding and enough results. If they want to do more, they can always do more, but a lot of people are done at that point. So 9 is our sweet spot. 9 sessions is what we offer, and you can lose 1 to 3 to 4 inches of girth from that belly fat. I went from a 40 waist to a 36 waist in 3 weeks. We have hundreds and hundreds and hundreds of client testimonials where they have lost 2, 3, and 4 inches of girth. That would be 3 dress sizes if you're a female, 2 pant sizes if you're a man, literally in 9 one-hour treatments, without any downtime, without any pain, without any burns, without any chance of hurting yourself. And it's amazing, but we're treating the estrogen-dominated fat. Now, with men, what happens with estrogen with men is they start to have lower testosterone. Now, testosterone is produced by a man's gonads, by his testes, and a woman produces the estrogen and the estradiol from her ovaries, but also from her body fat. Men produce estrogen from their body fat also, but we don't have ovaries. So it's our testosterone that runs the show pretty much our whole life. High levels of testosterone, small amount of estrogen. Makes you very strong male. I mean, good muscle tone, whiskers, the whole deal. What happens is, as men get older, beyond 50, and they're not exercising as much, and maybe they've had some habits that they've carried with them through the years, they will start to suffer from low testosterone. Low test, they call it. When you have low test, your estrogen becomes more dominant in your bloodstream. And that dominance leads to weight gain in men, typically around the belly and in the chest, male boobs. Men do not get the waist and the legs when they have high estrogen dominant or low testosterone. They get the big belly and the boobs, the male boobs. And, you know, it's a terrible thing. And it's easily remedied with the lipolaser because it's safe, it's congruent with health and healing. And they also need to understand why they're having this low muscle tone. You know, why aren't they exercising? Maybe they're not eating enough protein. Maybe they're too stuck in some habits they've carried for many years, alcohol, not exercising. Making some simple changes can reap a huge reward and benefit when it comes to this estrogen dominated fat. But this is the crux of all of these slim places, the body sculpt and the safe sculpt, the sculpture, the RF, the radio frequency, the hot lasers, cold freezing. They're all treating this estrogen dominated fatty accumulation that happens after 50. It really is. It's our market. And what's interesting is most of them are hurting people to get rid of the fat. They're either sucking it, burning it, freezing it, and there's a healing time. There's a process where sometimes the staff will make a mistake and cause a burn. Sometimes it makes them very unhealthy, and we don't want that. At the Slim Body Laser Spa, we are helping you to overcome this with a procedure which can shrink away and remove lots of that estrogen released fat. At the same time, we're interested in your nutrition and your overall wellness, your ability to handle poisons, how much you're exercising, are you drinking enough water? These are questions which the Cool Sculpting provider will never ask you, okay? Nor will the lipo guy. He's not going to ask you that, or she's not. They don't care. They have their procedure, and whether you know it or not, what to do, it's your problem. At the Slim Body Spa, we're able to handle the accumulation of fat similar to a surgeon might, but at the same time, you get the skills and the knowledge and the training, if you want it, of how to maintain and sustain it. And then once you're out on your own, you can always come back and do touch-ups at the Slim Body Spa. It's cheaper. So that is a summary of what we're doing. And I had a press release that I had done in the Boca Times. And I think it's pretty good, because once you've listened to what I've just explained about body fat and estrogen dominance, this will make a lot more sense to you, which is why I'm repeating this again. So here's the article. Basically, it says Slim Body Laser Spa of Boca Raton, which is now in Stewart, Boca is closed, explains estrogen dominance and the difference between weight loss and spot fat reduction. Dr. Drtredtv. Has anybody noticed all of these new non-surgical body sculpting places popping up all over the place? Why do we need them? Why can't traditional weight loss and exercise handle all of our body sculpting desires? Well, the answer is yes and no. Everyone knows, and all doctors agree, that weight loss can only be achieved by restricting calories, eating less, and exercise. But what happens when you're over 50 years old? And all of a sudden, you cannot seem to lose weight as easily as before. Even if you're lucky enough to be able to maintain your weight, you develop this unsightly belly flap, which just does not seem to go away no matter how much you diet or exercise. The reason for this accumulation of fat around your belly, regardless of how much you exercise and how little you eat, is most likely due to something we doctors call estrogen dominance. This is described in the literature as an improper balance between estrogen and progesterone. This happens to most of us, but with some it gets worse than others. Now I have a reference here, and that reference was from What the Doctor May Not Tell You About Menopause, written by Dr. John R. Lee, MD, and Virginia Hopkins Warner Books, 2004. So this is reference stuff. I continue. Your genetics, your age, your diet, your levels of exercise, and your levels of stress all contribute to this phenomena called estrogen dominance. In women, it can lead to thinning hair, facial hair, low libido, thin skin, age spots, and accumulation of fat around your belly, waist, and thighs. In men, it causes hair loss, low libido, emotional issues, male breasts or moobs, and the accumulation of fat, mainly around the belly and waist. It's what makes us look old, dumpy, and out of shape. Estrogen dominance in the adult is a condition which can be treated by seeing an appropriate anti-aging doctor. There are safe natural treatments also. You can improve your hair loss by utilizing low-level lasers to stop hair loss in individuals who still have some hair left. Supplementation such as vitamins and minerals can help also. So does exercise and a diet with lots of fiber. Detoxification regimens are also helpful for those suffering from estrogen dominance. Now, unlike weight loss and exercise, these spot fat reducing centers, such as my office at the Slim Body, can safely shrink these fat cells and are the best and only way of targeting this estrogen dominant fat. Now, my procedure shrinks the fat cells. All the other procedures, whether it's freezing, burning, radiofrequency, VeloShape, liposuction, they destroy the fat using an energy, and your body has to remove the dead tissue unless it's sucked out. My procedure doesn't do that. It doesn't create any damage to the tissue. It simply releases the calories using a laser to open up the fat cells. Whole body vibration moves it and circulates it into the bloodstream. You don't need 2 hours before, 2 hours after, and you will burn off that layer of fat. Amazing. Some of these spot fat reducing centers utilize low-level cool lasers like mine to target these resistant areas of subcutaneous fat accumulation. At my spa, in 9 40-minute sessions in 3 weeks or less, these lasers can reduce waist circumference by 3 to 9 inches. This is not the same thing as cool sculpting, people. This is not the same thing as ultrasonic or radio frequency treatments. The low-level cool laser is a non-surgical, completely safe process which works in harmony with how you naturally release and burn stored energy or stored fat. Results at the Slim Body Spa are seen the very same day, and the huge inch loss and improvement to your health is realized in 3 to 4 weeks. My name is Dr. Tret. My office is called the Slim Body Laser Spa. You owe it to yourself to at least find out if it could help. Up and through the next month, I think right up to October 12th, which is next week, we're still having a 5 cans of food donation. In exchange for 5 cans of food, you can lose fat. Okay, and it's up to October 12th. Bring in 5 cans of food, get a consult, exam, and get 1 laser session to try it out. Please take advantage of this. We had 10 people come in last week. 4 people signed for the program. Some of them just donated food. We did 3 laser sessions at no charge. So they got to try it out, and I bet they'll be back. And we're trying to help the Jensen Beach Christian Church with its food drive, and they feed the hungry families in our area. So thank you for tuning in. I appreciate it. I will see you soon. Bye-bye. Have a great day.